My name's Joan Kristal. I'm an anesthesiologist at Suburban Hospital in Bethesda, Maryland, and I've been practicing here for 22 years. I use the CarboTrack device pretty much any time I'm using sedation as part of my anesthesia. So in this hospital, we do joint replacements, probably 98-99% of the time with spinal anesthesia, and then some sedation to keep the patient comfortable in a room where there would otherwise be a lot of mechanical noise. And when they're sedated, it's difficult to come up with a way to see that they're exchanging air. And so I use the CarboTrack as a way of monitoring their end tidal CO2. I used to use kind of a funny system that I jury-rigged, and it sometimes worked, sometimes didn't. It was pretty unreliable. This gives me a lot of confidence to know that the patient's breathing, and I can be comfortable knowing we're not going down the wrong track. So this is a really easy device to use. It's pretty intuitive. You can't go wrong. It'll attach to any oral airway. I attach it to face masks when I use it for spinals. I often put a face mask on the patient, and I can take the CarboTrack and stick it over the little air holes, and I can monitor the end tidal that way. So in the past, I used to monitor end tidal CO2 one of two ways. Either I would have a face mask, a traditional face mask on the patient, and I would cut the end tidal tube and kind of stick it under the mask and hope that I could capture some CO2 exchange. What I really like about the device is that it gives me reliable information. If the patient is breathing, I am confident with this device that I'm going to get some kind of an end tidal tracing. I cannot tell you that the number that it gives me is the most reliable, but that's not what's really important to me. I can see a breathing pattern. I can see how deep they're breathing. I can look at the trace and I can feel comfortable. In terms of patient safety, I think this device really has it all over some of the things that we used to do to try and make it work. So I don't really see any reason that people wouldn't want to use it. It doesn't take up much room in the operating room. It's easy to transport. It fits on almost any oral airway. It fits on a face mask. It connects easily to the end tidal monitoring, whichever system you use, whether it's the ventilator or a little box. It's safe. It's convenient. I don't think it's particularly expensive, and I think it's pretty much a no-brainer.